Hi, hello everyone. Welcome you all to this CBRT YouTube channel. Thanks for your continuing support to us. This is the time to learn and review your knowledge. In this chapter, I am going to explain you about abnormal breathing pattern. After learning this, you will have some knowledge questions at the end of this video. So today our topic is breathing pattern. In this video, you will learn about normal breathing pattern and also some abnormal breathing patterns. We'll go to the session. Breathing is a basic rhythm of life. Breathing is central to life as it allows the human body to obtain the energy it needs to sustain itself. As a human, our breathing pattern is similar to our heartbeat. We do not have to consciously think about it, it just occurs automatically. This response is generated by the medullary respiratory center in the brain. The medullary oblongata is the primary respiratory control center. Its main function is to send the signal to the muscles that control respiration to cause breathing to occur. There are two regions in the medullary oblongata that control our respiration. The first one is ventral respiratory group, VRG. What it will do, it will stimulate the expiratory movements. The another one is TRG, that means dorsal respiratory group. What it will do is the dorsal respiratory group stimulate inspiratory movement. Apnea. Apnea is a normal, good, healthy and unlabored breathing. Sometimes we call it as quiet breathing. If you see in apnea, normally healthy people breathe the rate of 12 to 20 breaths per minute. In apnea, the normal breathing including breath type will be normal. The rate, depth and rhythm of breathing also will be in normal. As I said previous, if you see the rate, depth and rhythm of the breathing in this waveform, it will be in the normal level. So this is called apnea. As I said previous, tachypnea. Tachypnea means increased respiratory rate. If you see the patient will breathe more than 20 breaths per minute. Usually, when patient is hypoxemic or respiratory distress or patient have any pain or fever, if suppose the patient is anxious, their respiratory rate will go up. So this is called tachypnea. If patient has a ventilation or oxygenation problem, for compensating that, the patient will try to take more respiratory rate. That's why in the tachypnea, if you see their rate will be more than 20 and their type of breathing pattern will be very fast and sometimes shallow breathing. We saw tachypnea, that means fast respiratory rate. Here, bradypnea, that means slow respiratory rate. Usually the patient will breathe, the rate of respiration will be less than 12 breaths per minute. When the bradypnea may occur? When patient is on sedation or heavy alcohol usage, fatigue or sometimes drug overdose, the patient might have a bradypnea. This is the rhythm of bradypnea. If you see the waveform, it will be more widened. Apnea. Apnea means absence of breathing or no breathing. When it occurs, when patient is in cardiac arrest or respiratory arrest or airway obstruction, sometimes drug overdose, sleep apnea, the patient will not have a breathing. Apnea. In apnea, the respiratory rate rhythm will show like a flat line due to no breathing. Hyperpenia means forced respiration. Hyperpenia is increased volume of air taken during breathing. It can occur with or without an increase in respiratory rate. When patient has a congestive heart failure or metabolic or CNS disorders, the patient might have hyperpenia. In hyperpenia, the patient usually will take a deeper breath than usual, which increases the volume of air in the lungs. That's why the rate will be, sometimes it will be more, but the depth and rhythm of breathing will be fast. Chain stroke respiration. Chain stroke respiration is an abnormal breathing pattern. It may be characterized by progressively deeper and sometimes faster breathing followed by a gradual decrease that results in a temporary stop in breathing called like apnea. The pattern repeats with each cycle, usually taking 30 seconds to 2 minutes. It's like a wax and waning type of breathing. Gradually it will increase, then gradually it will go down, and few period of apnea. Then again it will start to go up and down. This is the rhythm of chain stroke breathing. If you see the waveform, gradually the depth is increasing and gradually it's coming down. Again, there is a fall in breathing, so that means apnea time. Then again, it's increasing and decreasing. This is a wax and waning type of breathing. Bayard's breathing is otherwise called as Atoxic Breathing. It's also an abnormal pattern of breathing. It's characterized by variable tidal volume, random apnea, and no regularity. Usually their breathing will be rapid with irregular period of apnea alternating with period of like a 4 or 5 breaths of identical depths are. It's like a similar to chain stroke breathing except that each breath has same depth. In chain stroke breathing we saw wax and waning type of breathing, but in Bayard's breathing it will not be like that. I will show you the rhythm. Bayard's breathing usually happen in high intracranial pressure and meningitis cases. You can see this type of breathing. As I said before, you see here the depth of breathing, it will be same level, but in between there is apnea and 4 or 5 breaths will come, then again period of apnea. So this is Bayard's breathing waveform. Kussmaul's breathing or Kussmaul's respiration or gasping breath is a deep and labored breathing pattern often associated with a severe metabolic acidosis, particularly in diabetic ketoacidosis patients. You can able to see this type of breathing. This breathing occurs only in advanced stage of acidosis and is not commonly seen. It's like a rapid, shallow breathing may be observed in less severe cases, but Kussmaul's breathing is a characteristic of deep gasping, even desperate manner of respiratory distress. This is the rhythm of Kussmaul's breathing. Their rate will be fast, sometimes. Apneistic breathing is another abnormal breathing pattern. It results from injury to the upper pons by a stroke or trauma. It is characterized by regular deep inspiration with an inspiratory pause followed by inadequate expiration. I'll show you the rhythm. Again, the apneistic breathing usually you can see in the head trauma, severe brain hypoxemia, lack of blood flow to the brain cases. You can able to see this type of breathing. See this apneistic breathing rhythm. Usually their respiration will have a regular deep inspiration with an inspiratory pause followed by inadequate expiration. Orthopnea is the sensation of breathlessness in the recumbent position. It will be relieved by sitting or standing posture. Paroxysmal nocturnal dyspnea is a sensation of shortness of breath that awakens the patient often after 1 or 2 hours of sleep and is usually relieved in the upright position. That means difficulty in breathing while lying down. When this type of breathing will happen, when patient has congestive heart failure or fluid overload or sometimes chronic lung disease, this type of breathing may happen. In orthopnea or PND, they cannot breathe when they are in lying position. So always they will sit and breathe. Like this position, it will be more helpful for breathing. The last one is paradoxical breathing. Paradoxical breathing is a sign that means the patient is not breathing properly. When it occurs means when patient diaphragm moves in opposite direction. Usually when you are inhaling, the diaphragm should go down, while exhalation, the diaphragm should come upward. If example, if patient has a flat chest, usually while breathing in, the chest should come up outside. While breathe out, the chest should go inside. But in flat chest, the patient will have some paradoxical breathing, like when patient during inspiration, the broken rib cage will go inside, while exhalation it will come outside. See this picture, you can able to understand it very easily. If you see this paradoxical breathing, the first picture it shows usually while inhalation it should come outward, but here the paradoxical area, the flat chest area, it goes inward. During exhalation it should go inside, but this flat area is going outside. So this is a paradoxical breathing. I think hope you understood few things about abnormal breathing pattern. So this is time to review. I just gave you a few questions to make your knowledge upgraded. Thank you. Thanks to everyone for viewing our videos. This video content I took it from respiratory therapy zone and TMS section questions. And this is the first time I'm giving voiceover to my video. Please adjust and support us. Thank you very much. Thank you.